Triglyceride Structure and Function Part 2. Normal triglyceride levels. Why is this considered normal? After collecting the results of vast numbers of lab tests, the data is calculated and the level that 95% of the population falls within is considered the normal triglyceride level. The data is further calculated to determine the other ranges we have for triglyceride levels. Here are the levels as per the National Cholesterol Education Program guidelines. Normal less than 150 mg/dl. Borderline high 150 to 199 mg/dl. High 200 to 499 mg/dl. Very high 500 mg/dl or higher. Again, these are levels based on a fasting sample. If your level falls within the normal range, good for you. But do take a look at the rest of the lipid panel to make sure your cholesterol level is okay, along with your HDL and LDL levels of cholesterol. How often should I get tested? There is some disagreement about how often routine screening for high triglycerides and other lipid disorders should be done. Factors you need to consider is your past health history, your current health and what diseases and conditions run in your family. The National Cholesterol Education Program, NCEP, recommends that all people older than 20 years should have a lipid panel done every 5 years. If the test is abnormal, then testing may need to be more often. You can check out the NCEP guidelines here. The American College of Physicians, ACP, recommends testing men over the age of 35 and women over the age of 45 unless there is a family history of heart disease or other risk factors for heart disease are present. What if my triglyceride level is above normal? Certain medications may cause high triglycerides. Are you taking any of the following meds? Birth control pills, steroids, diuretics, beta blockers, tamoxifen. Certain diseases and conditions may cause elevated triglyceride levels. Do you have any of the following? Diabetes, kidney disease, hypothyroidism, obesity. And, finally, excessive alcohol consumption can cause your triglyceride level to be higher than normal. What's excessive? More than 1 drink per day, 1 glass of wine, 1 bottle of beer or 1 ounce of hard liquor. If your triglyceride level falls above the normal range, consider having the test repeated before you make any decisions of treatment. Laboratories can make mistakes. Be sure to fast from all food and all drink except water for no less than 12 hours before you get your blood drawn. If, when you get the results from the second test, you find that your triglyceride level is high, then it's time to look at what is causing the problem and what you need to do to lower your triglycerides to a normal level. Following the guidelines set by the American Heart Association, normal triglyceride levels are level less than 150 mg/dl. High triglyceride levels. High triglyceride levels are determined through a blood test called a lipid panel or lipid profile. Oftentimes, it is referred to as a cholesterol check. Triglycerides are not the same thing as cholesterol, but they are similar in that they are both what is called a blood lipid. Other causes of high triglycerides. There are some diseases that can influence your triglyceride level and cause it to be high. Cirrhosis of the liver, low thyroid or hypothyroidism, pancreatitis, diabetes that is poorly controlled, kidney disease, genetic cause of hypertriglyceridemia. Familial hypertriglyceridemia is a genetic disorder that runs in families and causes high triglyceride levels. Familial hypertriglyceridemia occurs in about 1 in 500 people in the U.S. The cholesterol levels of people with this disorder are usually in the normal range. But there will probably be a family history of early heart disease. Subscribe our channel for future videos. Visit our website holisticmeaning.com for more informative articles.